This one here's a Narcan needle. Loaded. Waiting to save someone's life. This one here is just waiting to take someone's life.
In parts of downtown Moncton, this is a common sight. Free harm reduction equipment like needles, alcohol swabs, and pipes randomly discarded. All of it meant to give people a safer way to consume substances, according to staff at Ensemble Moncton. That group gives out more than 500,000 needles each year, sometimes dozens at a time to folks who live in more rural areas. But not all of them are disposed of safely, says founder of the Humanity Project, Charlie Burrell.
There's a lot of different reasons for harm reduction and why it works. I 100% support that. But as a community member, I shouldn't have to walk around and check my property every day for needles. Kids should be able to walk through the parks. People should be able to walk down the streets.
The city of Moncton does have several Sharps disposal boxes, 5 at local fire departments, and some at public parks and on street corners. But some needles still end up on the streets, a hazard for residents. Moncton's community officers patrol around schools every weekday morning to pick up discarded needles, something many local organizations working in this sector are trying to prevent. Burrell says he'd like to see a small reward given out for each needle returned.
For me, I think there has to be a solution that is both safe and responsible, both for the end user and the community. So I don't see too many pop bottles on the streets of Moncton anywhere. They pick them up and they cash them in. And I think that by putting a 5-cent deposit on needles that are returned, it will not only give incentive to the person to return their needles, but it'll also limit the amount of needles that are being given out.
If all needles were returned, the cost of Burrell's suggested rebate would be $25,000, which he suggests could be funded by the government or nonprofits. But not everyone agrees that's the way to go, because it might mean an added stigma and loss of anonymity for people who use drugs. For Debbie Warren, it's about removing barriers when it comes to safe consumption.
How about we provide supportive housing so people don't have to use on the street? How about we start there? How about we have mental health counseling supports for people? How about we help connect family back with community? How about we do those things, and then we won't find the issues that people are concerned about, such as needles on the street.
While not everyone agrees on the method, both groups agree it's important to tackle the root causes behind addiction as well as dealing with its effects.